Hey my badass doctors! Today we have a 52-year-old man who comes into your office for a routine physical examination. He is a new patient to your practice. Welcome! He has no significant medical history and takes no medications regularly. His father died at the age of 74 of a heart attack. His mother is alive at the age of 80. She has hypertension. Note here that cardiovascular issues should be a theme for this guy. He has 2 younger siblings with no known chronic medical conditions. He does not smoke cigarettes, which is great, drink alcohol, or use any recreational drugs, but he does not exercise. Upon examination, his vitals consist of a blood pressure of 127/82, pulse is 80 beats per minute, and respiratory rate is 18 breaths per minute. His height is 67 inches, and his weight is 190 pounds. On careful physical examination, no abnormalities are noted. What do you think of this case?
Didn't we do this yesterday?
While it's not exactly like a repeat of Groundhog Day, we had just finished up a case of a routine health maintenance visit for a 66-year-old woman in my last video, Internal Medicine Case 1, where we went over screening and vaccine recommendations and which apps I like to use. So that video went into greater detail. If you haven't seen it, go ahead and check it out. But this video is going to feel a lot more like practice. I didn't mean that kind of a practice. Come on, guys, get your head out of the gutter. Okay, we have a 52-year-old man coming in. He's got no active medical issues. He's got no history of complaints.
No problem.
And his physical examination came out pretty normal. What do you tell this guy? Hey Bob, good job, see you next year? No, we're gonna go ahead and see which screening recommendations and vaccines we're going to recommend for him. So, do you remember what those are? Don't worry guys, I don't even remember what I ate yesterday. So these are what these apps are used for, and eventually over time you'll know what it is as you see more cases like this and in different age groups. So as you get more practice, you'll get more used to it. For your patient to get the most out of this routine health maintenance visit, it's important to have a mental roadmap, also known as your clinical approach, to hit the 4 main preventative measures such as immunizations, behavioral counseling, chemo prevention, and screening. Let's go over the recommended immunizations.
I can't believe you guys. Don't you realize you're contributing to a potential public health disaster by not vaccinating your child?
That's exactly the point. My child. He's my child, and nothing matters more than his well-being.
Oh God, this is going to be a Lewis story, isn't it? Game of Thrones is on, just a reminder.
Yeah, we made this mistake before. We got the other kids vaccinated, but Meg still got chickenpox.
Dad, this is acne.
Great, let's look at the vaccine schedules according to the CDC. Okay, let's hit adult for 52-year-old male. Be sure to hit the right tab, which is the 50 to 64. Alright, the CDC is recommending an influenza vaccine annually, especially during the fall or winter months. Next would be the tetanus toxoid, reduced diphtheria toxoid, and the acellular pertussis vaccine, Tdap, if he hasn't had one when he was a kid, or if it's been 10 years to get that tetanus booster. Next would be the measles, mumps, and rubella vaccine, the MMR, if he hasn't had that before in his lifetime.
You happy now, Lois? Because of you, there's a measles epidemic and the whole town is quarantined.
Speak for yourself, Brian. I, for one, am enjoying the indoor family time.
I'm not that worried about it. It's not that crucial, honestly. It's 1 quarter, guys. You know what? Can you just give me a minute? I gotta go outside.
What were you saying? Oh, come on, Bill. You gotta trim the hedges now.
Peter, Brian's right. We were wrong about everything. We've got to get to the hospital and get Stewie vaccinated.
Yeah, it might be a little too late for that. I kind of destroyed all the vaccines in town.
start sweating. I'm leaving today.
Destroyed all the vaccines?
Yeah, but it's fine. There's nothing to worry about. Is anyone else feeling feverish, achy, and acutely sensitive to light?
Oh my God, Peter, you've got measles.
Now hold on. Before we all freak out, it might just be full body herpes.
And last but not least, 2 doses of the zoster vaccine. Let's talk about behavioral counseling.
Have you considered therapy?
For behavioral counseling, everyone should be screened for depression using the PHQ-2. If that comes back as positive for depression, then it should be followed up with the PHQ-9.
Since then, I've been afraid of toilet.
Next is to go over the naturopathic foundations of health, which are the building blocks of health. First, we should ask about his sleep. How many hours of sleep is he getting? Is he having any issues falling or staying asleep? And does he wake up feeling refreshed? The next thing to address, which is very important for this patient as his BMI puts him in the upper range of the overweight category, is to talk about diet and nutrition. If you don't have enough time to talk about this during this visit, I would refer him out to a dietary counselor or a nutritionist. As a doctor, I would like to know, what does he typically like to eat? How much water does he drink in a day? And how much fiber is he getting throughout his meals? I would also introduce him to the DASH diet to prevent further weight gain and hypertension. And make sure that he's getting proper amounts of omega-3 fatty acids. Also, praise him for the great things that he's been doing so far. The fact that he's not smoking cigarettes or he's not drinking alcohol. Do some motivational interviewing about his lack of exercise. Find out, is he not motivated to exercise? Does he feel intimidated to go to a gym because of his weight?
Right.
I'm feeling skinny, Tony.
You're the fattest boy in camp.
You've broken my camera!
Does he not have enough time to exercise? Does he have a sedentary lifestyle because he has a desk job? You know, figuring out how can we implement more movement into his life? Can we get him to start walking around the block in his neighborhood after dinner? We don't know, but there could be joint pain that he's dealing with, or maybe he's given up because he feels like it's in his genetics to get a cardiovascular disease since both of his parents have them. I mean, talk about this, like how lifestyle changes overcome your genetic disposition. As doctors, we should always give our patients a sense of hope and be their cheerleaders.
You can do it!
And give them achievable goals. Give them goals that they can reach. Baby steps. Remember, baby steps. This is how we got through med school. Okay, now, the American Heart Association recommends that they get at least 150 minutes per week of moderate to intense aerobic activity. Now, if we break this down, this is basically 30 minutes a day, 5 days a week. Now, moderate to intense activity includes brisk walking, dancing, water aerobics, tennis.
Sorry about that, dude!
Gardening, you know, things that are fun and enjoyable. Now, if they're going to go into the intense activities, they should do that for 70 minutes per week. And this is more like running uphill, running, swimming laps, aerobic dancing, or heavy yard work. Next, I would ask about how much sunlight is he getting? Is he staying inside all day? I mean, come on, man, you gotta get some sun. I mean, don't look like Gollum at the end of the day. Next, I would ask about his social life and his relationships. Are they healthy? Are they happy? Is he getting a very even amount of give and take in these relationships? Because the thing is, he's got to have boundaries. He's also have to have like great friends who will have his back whenever he needs them. Maybe like 3 in the morning. I mean, who knows? I mean, like, come on, we all need to have that friend.
I was asleep. Oh shit. I'm sorry. No, that's okay.
Also to know, like, does he have a sex life? I mean, not that he needs to have sex. I mean, come on. I mean, he's like, what, 52? So, I mean, he's still young. I mean, come on, man. Get laid.
I'm gonna get you laid.
No, you don't.
Hey, hi. This is my friend Kevin, and he's super hot.
And lastly, I would delve into what are his spiritual rituals. In other words, when was the last time he did something for himself in the form of self-love and self-care? How does he find ways to de-stress and reflect? Where does he go to get away from the city and find peace? Let's talk about chemo prevention. If we had his lipid panel to calculate his 10-year cardiovascular disease event risk and found out that it's 10% or greater, and he's got 1 or more cardiovascular risk factor with no history of cardiovascular disease, then we would put him on a statin to prevent him from getting any heart disease. Let's get into the screening recommendations. All right, docs, let's dive right in. I hope you grab your phones and follow along with me so you can gain some muscle memory doing this. All right, he's 52 years old, weighs 190 pounds, he's 5'7". He ain't pregnant.
This looks like a little weight to you.
He specifically said he does not smoke. And we don't know anything about his sexual life, so let's hit start. Alright guys, before we look at our different categories, it's important to organize our notes by making a basic skeleton for your chart note. I have divided it into the 4 different sections that we had mentioned, and now we're going to divide the screenings into cardiovascular disease, cancer, infectious diseases, and other health conditions. All right, let's start off with the cardiovascular disease. We are going to screen for hypertension in all adults. Now, in 2017, new guidelines from the American Heart Association, the American College of Cardiology, and 9 other health organizations lowered the numbers for the diagnosis of hypertension to 130 over 80 millimeters of mercury. Now, for this patient, his systolic blood pressure is 127, so you would think he's in the elevated category. However, because his diastolic blood pressure is 82, he's no longer in that category. He is now in that stage 1 of hypertension category. But because this is his first measurement at our visit, we would wait until we get a second reading from him on a subsequent visit and take the average of the 2 blood pressures. Next is the screen for hyperlipidemia, because this is another risk factor for cardiovascular disease. We would start screening in children if we knew that they had a history of familial hypercholesterolemia. Otherwise, for men, we would start at the age of 35, and for women, we would start at the age of 45 until they all reach the age of 75. And we would be checking this every 5 years. And the screening can take the form of non-fasting total cholesterol and HDL cholesterol levels, or a fasting lipid panel that includes the LDL cholesterol. Next is diabetes, because this is another risk factor for cardiovascular disease. Now, there is insufficient evidence to recommend screening for asymptomatic adults for type 2 diabetes. However, if the patient has a diagnosis of hypertension or lipidemia, or has a BMI of over 25, which puts them into the overweight or obese category, then we would screen by running a fasting blood glucose every 3 years until they're the age of 70. Our patient is at a BMI of 29.8, which puts him just shy of being in the obese category, which starts at 30. So we would obviously be screening for diabetes for this patient. Although our patient doesn't fit into this next category, we would run an ultrasound to assess for abdominal aortic aneurysm in men ages 65 to 75 who have smoked. If they've never smoked before, then they don't need to get an ultrasound for abdominal aortic aneurysm. For many years, most people think an annual visit includes an annual chest x-ray, electrocardiograms, But nowadays, we don't do those. We don't routinely run an EKG or an exercise stress testing or some CT scanning for coronary calcium for coronary artery disease unless the individual is at a higher risk for a coronary event. Now let's move on to cancer. So for every adult starting at the age of 50, it is strongly advised to screen for colorectal cancer because this is the kind of cancer that stays very quiet. You don't know if you have it. It's got a very, very sneaky way of hiding in your body and being asymptomatic. So this needs to be screened for every adult, and there is 3 different categories of doing it. You can either do it annually through a fecal occult blood testing using guaiac cards on 3 consecutive bowel movements collected at home, or you can do a flexible sigmoidoscopy with or without an occult blood testing every 3 to 5 years, or do a colonoscopy every 10 years. Now, if either the first 2 options come back positive, you definitely need to go in for a colonoscopy. Currently, the USPSTF recommends against screening for prostate cancer using a digital rectal exam or PSA. However, the American Cancer Society recommends that men have a chance to make an informed decision with their healthcare provider about whether to be screened for prostate cancer. The screening and discussion should start taking place at the age of 50 for men who are at average risk of prostate cancer and are expected to live at least 10 more years. It could also start at the age of 45 for men at high risk of developing prostate cancer. This includes African Americans and men who have a first-degree relative who was diagnosed with prostate cancer younger than the age of 65. And this also could start at the age of 40 for men who have more than one first-degree relative with prostate cancer. USPSTF also recommends against the screening of testicular cancer and pancreatic cancer in asymptomatic adults. We would check for lung cancer with a low-dose CT chest annually in adults ages 55 through 80 if they have a 30-pack year smoking history and currently smokes or have quit within the last 15 years. Our patient doesn't smoke. Hopefully he doesn't pick it up later in the future before he's 55, so until then he does not need to be screened for lung cancer. Alright doctors, this is Dr. Sola signing off. See you next time. Mwah.